Ladies and gentlemen, welcome aboard the Pilot Lawyer Podcast. Thank you for your attention while this important legal information is reviewed. What you hear should not replace consultation with an attorney and should not be considered advice for your situation. On behalf of the Pilot Lawyer and your entire crew, it's our pleasure to have you aboard.
Welcome, aviators, to the Pilot Lawyer Podcast with us, the Eisen brothers at the Eisen Law Firm, where aviation law is all we do. You're here for what we do best, navigating the FAA medical certification process for pilots and those who want to become pilots. And of course, if you don't laugh, you cry. And for the next 30 minutes or so, we hope to bring you the lighter side of what can otherwise be a very frustrating and tedious process. So whether you're laughing at us or with us, join us brothers as we discuss the fascinating world of FAA medical certification.
Tedious sounds about right, just like how you read that opening.
Hey,
Tedious. It was
just following your lead, man.
tedious or mind-numbing.
Well, fortunately, we have something of a non-mind-numbing
Something
episode.
to awaken the senses?
Something that will liven you right up.
A guest? Could it be a guest?
It is a guest.
How's that possible? I thought people were...
Well, hey, we got to thinking we're really burying the lead here. We've got, the psychologists, the psychiatrists, we've got the neurologists, the sleep apneists. And, what about how do we start this whole process? How do we get it revved up?
How do we get to where you'll need us?
3 letters, AME.
Okay, sure.
Sure.
Moving on.
So we thought we'd get a competent AME to come in and tell us mostly, and the listener, one listener, what's going on.
I've been doing this for years, and I finally feel like I'm going to learn something here.
Yeah. Mm-hmm. So today...
No thanks to you, Anthony.
That's right. Today we're going to have Dr. Auren Weinberg, who's a senior aviation medical examiner with over 25 years of medical experience. It's more than you guys have rubbed together.
I'm not rubbing anything.
Dr. Weinberg provides convenient, efficient, accurate medical exams for pilots of all classes and air traffic controllers. And he is a private pilot. So put that in your pipe and smoke it.
Let's see if we can get him on the phone here and ask him some questions about the AME process and what he does.
Sure. Let's see if he answers.
Hello.
Hi, Dr. Weinberg. This is Chris Eisen.
Chris, how are you today?
I'm doing well, thanks. I got Anthony and Alex here with me as well.
Hey, Dr. Weinberg.
How's it going?
Fantastic. Great to hear from you guys. Appreciate it.
Likewise, we were afraid you weren't going to answer.
He finally listened to all the episodes and realized what he was getting into.
Big mistake, he said.
Yeah.
Well, we've already hit the record button, so if you want to just jump into it here, we're ready when you are.
Oh, okay. So you guys do edit post-production. You don't leave it raw.
Yeah. There's a lot of editing that needs to be done after these.
We're going to take out every third word you say. And
Oh, my gosh. I'll probably make more sense if you do that.
yeah.
Well, that's the only way Anthony ever makes sense around here. So.
I gotcha.
That's nice.
Well, listen, Dr. Weinberg, typically what we do is we have our guests introduce themselves, give us a little bit of background for the listener as to what you do and where you do it and so on and so forth.
Sounds great. Well, thank you so much for having me on this podcast. I really appreciate it. My name is Dr. Auren Weinberg, and I am an senior aviation medical examiner, and I work in Florida. I have offices in Clearwater and a newer office in West Palm Beach. And my office does just certification exams. We're not a practice that also takes care of sick patients or does, checkups, annual checkups for people or any of that. We just do certification exams. That's our area of interest and focus. And I am a private pilot myself, so I understand some of the challenges that pilots face when they go ahead and try to get their medical. Both first time and also renewal. So that's kind of my background.
That's an excellent segue there, Dr. Weinberg, into the next question, the first question that we have. And that is, as an AME, what types of things are you looking for during your physical exam of an applicant?
I feel like you're yelling at him.
Am I?
Why don't you bring the tone down a little bit?
I don't know.
Sounds good to me, but my hearing's not so great, so you're good.
Well, let's not tell the FAA.
Yeah, right.
Hey, the FAA might listen to this, so, unless you're on a soda.
We're paranoid to think they listen to everything we do. So.
Yeah.
Yep. Well, one of the interesting things is, even though many people refer to this as a flight physical, the physical part of it is really only a small part of what we do. We do focus a lot on the history, and then we do some testing that's very important, like blood pressure, vision, just a general hearing kind of screening, and those sorts of things. And it's actually not usually the physical exam that tends to trip up the pilots. It's more the other pieces, particularly around the history. So just to give a quick overview of the process, the first thing that we ask pilots or potential pilots to do is to go into the FAA system called MedExpress. That's MEDXPRESS. So you leave off the middle E. And the way they do it is they go in and create an account if they don't have one, and put all of their medical history, medications, etc., into the system. And they need to have that done before they come to the visit. And that's important because we can't actually capture that information without an application being in the MedExpress system. And then the pilot or the student brings it to us brings us just the confirmation number, which they get in email and also shows up at the end of the process. And then we go ahead and pull that up when they come in. And that's when we start the process. We'll do, as I said, a history. We always check ID because that's a requirement for the FAA as well. And we want to make sure it's the right person. And then we sit and talk a little bit about their medical history, make sure there's no issues or red flags. And if there are, we start to talk about how we can overcome those hurdles or what the FAA would expect. We do some, as I said, a vision test, and we also do a urine test. Some people worry that the urine test may be for some illicit substances. In this context, it's actually not. The FAA is mainly looking for protein or sugar in the urine, because those can be signs of systemic disease. So things like diabetes or the kidneys not working properly. So those are the things we look for there. And then, as I said, we do blood pressure and pulse. And then we do the physical exam. And we talk to the pilot or student about what the hurdles may be, if there are any, what kind of additional information we may need, what the pilot can expect for next steps, or if all goes well, as it often does, we just go ahead and issue their medical certificate right on the spot. So that's kind of an overview of the process for what pilots should expect.
Oh, very nice. Students. Very nice. Well, what in those instances that you say that there might be a hurdle, what do you typically see that would warrant a deferral of that application to the FAA for further evaluation and review?
Well, the way I think of this is kind of in tiers. So the simplest pilot or student to see is generally going to be the one that does not have medical issues, only takes routine medications over the counter, that sort of thing, or no medications, and in general is in good health. And that pilot typically, as I said, will get issued their medical certificate at the end of the visit with no issues. The next step above that is a group of pilots that may have something called a CACI, which is a condition that an AME can certify. So that means that the FAA has delegated the aviation medical examiner like myself to gather some basic information. Usually it's a note from the doctor. And if we get that and it certifies that the pilot is in good health, then we can go ahead and issue the certificate despite that medical condition. Some examples of that, some really common ones, are high blood pressure, a history of prostate cancer that's been treated and is now in remission, asthma history, things like that. So that's called a CACI, a CACI. And again, that's just going to generally require some documentation from the patient's provider, their physician or extender, and to get that to us, and then we can go ahead and issue. The next group up from that is a group of conditions that would cause something called a special issuance. And a special issuance is something that the FAA will make an exception and allow the pilot to receive a medical certificate, but there's some testing that needs to be done. And that testing really varies. The FAA generally has specific protocols, and that can be for things like a history of heart disease with a surgery, like maybe a stent, a history of a heart valve replacement. It could be heart rhythm issues. It could be, a lot of different things, not just heart, but, a lot of different health systems, eye surgeries, things like that. Those kinds of things generally will require a special issuance. And what we do is, as the aviation medical examiner, we collect all of the information, anything that we have from the pilot, and then, or the student, and we send that into the FAA. We wait for the FAA to respond, and they'll tell us, and they'll tell both the aviation medical examiner and, more importantly, the pilot or student what's needed. And that pilot or student can gather all of the information. And then we go ahead and submit that. And then once that's submitted and to the satisfaction of the FAA, then they get their medical certificate, I should say. And then there are some follow-up situations where there's something called an AME assisted special issuance, or an AASI. And that's typically the pilot has already received a special issuance from the FAA, and now they are just getting recertified. So again, those will generally be protocol driven, and the pilot will know, based on conversations with the aviation medical examiner and the letter that they get from the FAA on the initial special issuance, of what to expect, what frequency, and things like that. So those are sort of the four levels. There's just medical certificate, there's CACI, there's special issuance, and there's AASI. And then, of course, there are some other things in between, which are sort of in gray areas, like maybe there's, the patient has a remote history, or the pilot or student has a remote history of something. And in those situations, we may need to customize a little bit. One thing that pilots or students can do is, if they have a medical condition that they think might be significant, is to go on a search engine and put in FAA and their condition. And most of the time, that will actually pull up the FAA's rules about that condition, and whether it's going to require something like a special issuance, a CACI, just for the aviation medical examiner to just document it. And then they can really know what to expect and what to gather before they come for their appointment.
Sure, yeah. Well, are there certain conditions that would prevent you from being able to issue a medical certificate? That whether or not through the CACI or special issuance, or...
Now I feel like you're being too quiet. you're whispering the questions now. Make up your mind.
I would say there's mainly two categories of things that would prevent a pilot from getting their medical certification. Number one is, there are medications that are considered no-fly medications. So that one is easy for a pilot or a student to look up, because you can just go on the FAA site, or again, go to a search engine and just put in no-fly medications FAA, and you'll see the list. And sometimes I do have, it's usually students coming in that are not aware that these are no-fly medications, and the pilot or student would have to get off them before they receive their medical certification. And then, in addition to that, there are some conditions that tend to make getting a medical certificate extremely difficult. I won't say impossible, but certainly difficult. Some are just frankly impossible. So, for example, I have not seen the FAA ever give a medical certificate to a pilot that has a bipolar disorder that's, perhaps active, or a pilot that has had recent suicidal thoughts, other types of mental health conditions. And those tend to be the big ones that will stand in the way. So it's usually mental health conditions or medications. Most of the physical conditions requiring surgeries and treatments and things like that, once the pilot or student is in good health again and in remission, or kind of back at their baseline health, in general, I would say most of those can be overcome. So, but it's mostly mental health or certain medications that would prohibit the pilot or student from getting their medical certificate.
So I would imagine that the 8500, the application, is probably very important to you as an AME when you're doing this examination? Because otherwise, how would you know if an individual has maybe a history of bipolar disorder or some type of mental health issue? Because a lot of times I think people will come in with those types of conditions and present, maybe fairly well in person, but you wouldn't necessarily know just by looking at them or talking to them for a little bit that, they have this potentially disqualifying condition. So in your estimation, using the 8500 to do these examinations, I mean, how does that assist you?
Well, it's critically important for pilots and students to be thorough and be accurate when they complete their 8500 for a couple of reasons. One is obviously if there are any conditions, we want to know in as much detail as possible what has happened or what is happening so we can assist the pilot and advocate for them to get to their medical certificate. That's number one. The second thing is if the pilot or student forgets to put something on the medical, we can actually, on the 8500 through MedExpress, we can actually add it during the appointment. So as long as they tell us, we'll add it, but obviously that takes more time. Mm-hmm. Most importantly, I would say if pilots or students are omitting things on the MedExpress application, which comes onto the 8500, the biggest concern there is, I think, the pilot and the student may not be aware that these conditions can significantly impair their ability to fly, which number one endangers them. Number two endangers the people around them, right? Anybody can be impacted by, heaven forbid, an incident in aviation. And then finally, if a pilot or student is caught not telling the full story or not being honest about what they've applied, what they put in their application, there's certainly their medical certificate and their pilot certificate would be withdrawn, would be revoked. And they could even face jail time and very significant fines. So it's important to be thorough. It's important to be honest, just like you're saying. And that will help expedite the visit to the aviation medical examiner and keep the costs down as well.
Has your FAA medical certificate been denied? Are you concerned you may not be able to get a medical certificate from the FAA? Are you at risk for FAA action for failing to report your medical history appropriately? Call the pilot lawyer at 1-855-FAA-1215 to discuss your options for getting the FAA to issue your medical certificate and get you flying. We are happy to evaluate your case and discuss with you a plan for presenting your case to the AME or the FAA. Aviation law is all we do, nothing else.
Well, I've run out of questions here in my tiny little brain. I think Anthony's signaling.
Let me,
he's got one.
Let me tag in here. Dr. Weinberg, let's say someone like Christopher came in and was caught totally off guard that he had all sorts of issues going on. And let's say he had hypertension, for example, and he didn't come prepared, which wouldn't surprise any of us. And he had he was taking, hypertension medication. As an AME, are there things that you can do to where you wouldn't have to defer that? So, for example, can you delay the exam, or can you kind of walk us through what options an airman may have with their AME? Because sometimes what we'll see, not to make this question so long, but sometimes what we'll see is somebody will go to their AME and the AME will say, oh, I can't do anything to help you, and that's it. And I'm going to defer this. Wow. And then it leaves the airman in a bind because they don't have a medical. They have to go through the deferral process. We've seen that a few times, even recently, quite to our frustration, when we know that there may be some alternatives in certain cases like that. Can you kind of walk us through what options you might have as an AME in those types of situations?
Sure, and that's really a shame. We try to work with our applicants to make sure that they're given every opportunity. We do have some time, and the FAA does give a little bit of a grace period. And I usually tell candidates that any issues that we have outstanding, we try to resolve within 10 days. And we can hold the application at least that long, even maybe a few days beyond that. We don't like to get too close to the deadline because if we don't make the deadline, that's very bad for us as the AME. But in a situation like you described, typically what I do with the with the candidate is I'll say, you have this medical condition, let's say high blood pressure. I need to make sure that, and the FAA needs to know through me, that your blood pressure is under control, that your medication is stable, and those sorts of things. So I will typically give the candidate instructions on what I need. It can be a letter from their provider, and I tell them what needs to be in that. Or sometimes I'll even hand them a checklist that they can have their provider fill out to make sure that they meet all of the criteria and the provider includes everything that's necessary. And then as long as the candidate gets that back to me within that 10 days and there were no other issues, then I can still go ahead and issue the medical certificate. Okay. The other time that comes into play, in addition to tacky type conditions, is when the candidate has trouble with some part of the vision exam. I had a young man who was with me just a couple of weeks ago, and one of his eyes, his distant vision, did not meet the criteria. And he was, I think, only 16 years old, so a young guy, and he was shocked. And I said, listen, we have to make sure that you meet these criteria before you get your medical. And he couldn't believe it, but we tried a number of different methods to test his distant vision, because we have a few methods in case of a situation like this. But he couldn't pass. And then I turned to his dad, who was with him, and I said, hey, Dad, when did you get glasses? And he said, I was about 16. And I said, well, there you go. Yeah. So we sent him back to his eye doctor, and his eye doctor got a pair of glasses made for him, very quickly. And I had him back within the 10 days, and he was able to pass with excellent vision all around. And he was able to get his medical certificate without a deferral. And that's important what you're asking, because the deferral process with the FAA, just because there's so much work for them to do, tends to be a very long process. It's typically measured in months, not days or weeks. So anything we can do to support candidates to not have to defer them is always preferable. So I think it's a great point that you're making, and I think it would be helpful for pilots and candidates to know that they're working with an AME that's going to advocate for them and give them every opportunity to get their medical certificate issued on the first try without a deferral.
Absolutely. I think that's one of the most important things when selecting an AME, that you're not going to have someone that just closes the door on them when things get tough, So kind of like with us, when we get a hard case on the phone, we just hang up. But
right.
But
I certainly hope. I know you guys don't do that.
We don't. Christopher might. I know. But that being said, Dr. Weinberg, as far as the one other sort of building on that topic is, you had kind of mentioned gray area conditions. Maybe there's some issue with respect to just spitballing here, maybe a mental health concern that's not, bipolar or specifically disqualifying. Maybe it's a distant history, and maybe it is not something that you would be inclined to defer, but it's sort of, like you said, a gray area. Are there opportunities that can be taken for the AME to contact somebody at the FAA and get perhaps a verbal authorization to issue a certificate? And what does that look like? And just to kind of build on that question even further, it's my understanding, what do I know? But it's my understanding that maybe these opportunities to speak to doctors at the FAA maybe only happens on certain days. So is there anything that you can think of as far as, maybe an airman with a gray area condition maybe plan to see their AME on the day where you might be able to call the FAA and so on?
Yeah, that's also a great question. And I actually am one who tends to call the FAA for every one of these gray areas, again, with the intention of making sure that we're doing the right thing and following the FAA's rules, because I'm delegated by them, but at the same time, trying to avoid a deferral at every opportunity. So what they call the dock of the day at the FAA is typically there Monday, Wednesday, Thursday, and Friday.
So don't go on
Now,
Tuesday.
They're not there on Tuesday, right? But I will say you don't have to avoid your AME on Tuesday if you're concerned about an issue because, as I mentioned, we do have this grace period. And frankly, the doctor of the day, because they're very busy at the FAA, they don't tend to answer right away. So it usually is the sort of thing that you will typically hear back, same day or even next day, but towards the end of the day. So I typically don't keep the candidate waiting. I call the FAA with the candidate there so that they know that I made the call. And then I just tell them, let's wait to hear back before we do anything. I'm not going to defer you. I'm not going to issue you. Let me see what the FAA says. I had a case like this actually just a couple of weeks ago. I had a young man who had an incidental finding on an MRI that had no impact on his life. He had no physical symptoms of it whatsoever. But I wasn't totally comfortable with the fact that it couldn't happen, that maybe with the extra stress of being at altitude or, G-forces and such things, that it might not affect his medical finding. And so I called the FAA, and I did get a call back from them that night, and unfortunately had to defer this pilot just to be safe. But there are situations where I have called the FAA, and they've said, no, you can go ahead and issue, just note this in the box where we have comments that we can read from you. Well, one such example of that would be some of these weight loss medications that are typically being used for diabetes, especially type 2 diabetes, but now are being used for weight loss alone if the weight loss need is high enough. The FAA actually, at least as I've seen, has not published any protocols for what to do in a situation where a candidate is on a weight loss medication like one of these injections, but does not have diabetes. There are clear sets of rules if you're diabetic, but if you're just using it for weight loss, it's not published yet. So I had a pilot like this the other day, and I called the FAA, and they said, actually, this medication is allowed. Here are the rules. So make sure you follow these rules. And of course, it's documentation from the physician and follow-up, et cetera. And you can go ahead and issue and just note in box 60 where we can note things to the FAA saying that XYZ and you're monitoring and you'll upload these additional documents, which I did. And so I was able to issue that pilot, which was very fortunate.
Nice.
And again, just reading the FAA's rules online without having called the doc of the day, I would not have known that.
Sure. Well, that's good to know. And I think that segues into my next question, which is essentially in these cases to assist you in being able to maybe make a push for the airmen, and if you do have to call the doc of the day, are there any documents or is there anything you can recommend that an applicant do to be prepared for an exam? I mean, maybe for just a regular exam, no issues, an 18-year-old kid walking in, maybe there's nothing to do, right? But somebody who's maybe had a medical issue intervening since their last application, is there something or anything that you can recommend that they bring with them to help assist the process?
Well, some candidates do bring medical documents. I typically don't need them at that first visit. What I typically do need at the first visit is an understanding of the diagnoses, the treatments, and the timelines. That's something that if every candidate came in with their medical history written down that way so they could communicate that to me, that would be extremely helpful. Like I had atrial fibrillation in 1987, in 1988. I had a procedure to fix that. Then in 2012, I had a replacement of one of my valves. Then in 2018, I had a concussion without loss of consciousness, and I was not hospitalized, but I did see a doctor for follow-up through 2019. Like those are the kinds of things that are really helpful at that first visit. That's number one. And then obviously, if we need medical records, we can always go ahead and gather those after the fact. Number two is I always encourage candidates to consider making an appointment for a consultation with me or with an aviation medical examiner that's open to it before they go ahead and just put everything into MedExpress and come in as if it's just going to be a regular physical. Because a lot of times we can spend some time together going over timelines and treatments and medications and really prepare for what we think the FAA is going to do. Because again, as I mentioned, there are a lot of these protocols, right? So you had cancer. What kind of cancer was it? Were the margins negative? Did you have metastases? Each of those situations is going to be a little different. But number one, the FAA has published information that I can review with the candidate and say, we're going to have to defer you when you do your physical, but come in with all of these things. And as long as you have all of these things, I'll get them uploaded right away. And hopefully we'll have a quick turnaround and the FAA will get you your special issuance. Or there's even situations where I could say to a pilot, for example, let's say they had prostate cancer, but it's in remission and, they're a period of time out from the treatment and they're doing well and their PSA is under control. That may just require a CACI. Whereas, if it's maybe within a few months after the treatment and the patient, the candidate is not established as stable yet, I might be able to say to them in a consult, listen, let's wait, because I don't want you to come in and do your physical and then I have to defer you. Let's wait until you've met the criteria for the wait time. And then you can come in with all the documents that I'm going to tell you to gather and bring to me. And then either I can issue you or we can defer, and you should have a relatively quick turnaround from the FAA. So don't be afraid of the consult. A lot of people, I think a lot of candidates are kind of hesitant because the consult does cost money and, it does take aviation medical examiners time to do that. But in the long term, you're actually going to save yourself a significant amount of time and money as long as the aviation medical examiner is willing to listen and work with you and try to do everything they can to expedite the process.
Absolutely. I think that's great advice. And I think you've got a lot of great information here for Airman Dr. Weinberg. So we're so happy we've had you on. And we understand that you are in the process of becoming a HIMSS AME as well. Is that right?
That's right. I actually am about to become a HIMSS AME. Probably by the time this airs, I will hopefully have passed the test.
All right.
And HIMSS is a really interesting program that I think is important for candidates and pilots to know about. And HIMSS generally covers two areas. One is addiction, so substance abuse, particularly alcohol and other substances as well. And then pilots who are on antidepressants, particularly there's 4 SSRIs and now also Wellbutrin, which is the generic is bupropion. And pilots in those situations can work with a HIMSS AME to get their medical certification and continue to be monitored to make sure that they're safe to fly, and their HIMSS AME can work with them to get them that initial special issuance and also to continue with their further certifications as time goes on and make sure that they're meeting the criteria. So, yeah, that's an important point that HIMSS system, that HIMSS program is available to pilots, so they shouldn't think that it's not. One thing I always like to tell pilots about or candidates about when it comes to HIMSS, and frankly, really any situation that may require a special issuance, is that there is one significant time involved. As we mentioned, the FAA is just overloaded with work. And, for not blaming anybody, but just saying turnaround times can be extremely slow, again, in the months time frame. So it's helpful if an aviation medical examiner has a consult so that the candidate can know what to expect by way of time. And then the other is expense, because both of these pathways require going to specialists for special testing and evaluations, and those continue really lifelong as long as the candidate wants to continue to fly. And it's important, I think, up front to know what those associated expenses are, just so that there's no surprises.
That's excellent. Well, we certainly here at the Eisen Law Firm and the Pilot Lawyer Podcast, and we wish you the very best with the HIMSS test, because we think you're going to be a great HIMSS AME and an advocate for airmen for sure. When you do become a HIMSS AME, your offices, again, are in Clearwater and Palm Beach, West Palm Beach. Is that right?
That's right. Yep. We're right near the Clearwater St. Pete Airport in Clearwater, and we're right near the West Palm Beach Airport in West Palm Beach. So always happy to see pilots.
If somebody wanted to find you online, where would they go to find you?
Oh, yeah, that's great. Thanks for asking. They can go to flydocfl.com. So it's FLYDOCFL.com, and they can book their appointments directly online, or they're certainly welcome to call us anytime, and our phone number is there as well. So we're always happy to talk to pilots even before they start the process, just to kind of check in, and certainly during the process, we're there to support them and advocate for them.
Well, Dr. Weinberg, thank you so much for being here with us today. We have greatly appreciated your insight and as well as your advocacy for airmen out there. Help make our job a little bit easier on our end. And we look forward to maybe having you back on another episode in the future to delve into it maybe in a little bit more depth into some other areas.
Sounds great. Well, I really appreciate you having me, and I also want to tell you all how much we appreciate what you do on behalf of our pilots and candidates, helping them to make sure that they meet all the criteria for safe flying while getting their medical certificate. So it's very important that you're doing this work. So thank you so much.
Thanks.
Yeah, we got one doctor out there that likes
right.
us.
Spread the word. Tell the folks at the HIMSS meeting that.
Yeah.
Exactly.
All right, sir. Thank you so much.
All right. We're turning base to final. Do you think Alex could say a few words now? I mean, for crying out loud.
You know what? You guys just dominated that whole thing.
Alex has been watching from the ground. As we fly around.
It was blimp day. I was watching the blimps.
I had no idea what's going on.
It's that fear of flying kicking
Sitting
in.
on the porch drinking his sweet tea in the rocking chair at the Bartow Airport.
That's actually probably the best place.
That's a good place to keep you.
Alrighty.
Okay,
Well,
go ahead and
so,
wrap it up.
So say what you got to say.
Okay, well, you vlogged another eventful, however you want to look at it.
When there's a guest, it's eventful. We just did that.
Okay. Oh, I'm just saying.
Okay.
Half hour listening to the Pilot Lawyer Podcast. And even though all of our guests deny they know us, not only in public, but just in general, we are the Eisen brothers of the Eisen Law Firm. We'll see you next time.
This is thepodcastfactory.com.